Welcome, everyone. My name is Trenton Ridge. I'm a graduate student at GCU, and this microlearning presentation focuses on the importance of using 3 patient identifiers before accessing or documenting in the electronic healthcare record. Now, in the labor and delivery and the NICU environments, nurses work in fast-paced, high-pressure situations where patient safety depends on accurate documentation and correct patient identification. So this training was designed using what's called the Mayor's Multimedia Learning Principles. They're meant to support some engagement, reduce cognitive overload, and improve retention of important safety procedures. So throughout this video, you're going to review a real-world scenario. You're going to learn the approved patient identifiers that we can use and apply safe EHR documentation practices that are going to help protect both the patients and the healthcare staff. So this particular scenario is going to demonstrate how quickly documentation errors can occur when patients rely on shortcuts during busy clinical situations. So let's assume the scenario that's during a shift change and the nurse searched the EHR using only the patient's last name and room number rather than identifying all required identifiers. So because 2 patients had similar names, documentation was entered into the wrong chart. Situations like this can lead to medical errors, incorrect treatment, patient privacy concerns, and overall delays in the very important care we need to give them. So this particular example highlights why nurses must consistently follow patient identification policies, even during stressful or fast-moving workflows. So the 3 approved patient identifiers include the patient's full legal name, their date of birth, and their medical record number should they already be established with us as a patient, also known as the MRN. Nurses should ask patients to verbally state their information rather than simply confirming information that's just displayed on the chart or on their wristband. The MRN is especially important because it is a unique patient identifier. This will allow the patient to become very singular within our healthcare system. These identifiers should be verified every time a nurse accesses the patient's chart, administers any medication, documents any sort of care, or performs procedures inside of the EHR. So this simple but very important workflow demonstration is what outlines this recommended sequence for safe patient identification before documenting in the EHR. So first, we ask the patient to verbally state their full legal name and date of birth. Next, we verify the medical record number using either the patient's wristband or the information that's within the chart. Then finally, we can confirm all 3 identifiers, including that second one, which is typically going to be that date of birth, are going to match before proceeding with any documentation or any sort of a treatment. Now, following a consistent process is going to help reduce these errors. It's going to improve the overall workflow efficiency because we all depend on each other. And it's going to strengthen the patient's safety, which is the most important aspect across the entire healthcare environment and across their entire healthcare journey with us. Now, there are several common identification mistakes that nurses should avoid. These include relying on room numbers, skipping the MRN verification step, or assuming patient identity without verbal confirmation. Room assignments can change frequently, especially during admissions or during transfers, and should never be used as approved identifiers. Nurses should always pause and complete the full verification process before accessing this chart or documenting any sort of care. So preventing these mistakes is going to reduce the risk of this patient's harm, and it's going to overall improve our quality of care. So this quick knowledge check is going to allow us to apply these patient identifying concepts in a realistic clinical scenario. So we can review, then talk about the answers carefully with each other. We can determine which of these nursing actions demonstrates the correct use of a patient identifiers before accessing this EHR. Also, a question that you might want to ask yourself is what sort of patient identifiers are not appropriate? For instance, a patient's photo, would this be considered appropriate or not? Now, we also can discuss what sort of steps do we take should we accidentally open or begin documentation inside of the incorrect chart, and we'll discuss that together. So let's take a few moments to reflect on the safest response before moving forward. So the correct patient identification is directly going to be connected to patient safety outcomes. So when nurses consistently verify these identifiers, they're going to reduce the risk of medication errors, patients getting the wrong procedures, mistakes or errors within the documentation, and HIPAA or patient privacy violations. So in this instance, when we are in the NICU or in a labor delivery setting, these safety practices are especially important because these patients may have similar names and overall complex care needs as the patient next to them. Accurate patient identification supports safer healthcare delivery, and it's going to strengthen the trust that our patients have in us as healthcare providers. Also, within the OB perspective, the health and safety of their children. So what do we take away from this? Nurses should always verify the patient's full legal name, their date of birth, and their medical record number before accessing or documenting in the EHR. If we follow these practices consistently, we're going to reduce these preventable errors and protect our patients' safety. Nurses should also remain aware of the privacy responsibilities and organizational policies regarding our EHR documentation that we have the responsibility of every day to uphold. So small safety steps such as using these identifiers can certainly make a significant a difference in protecting their patients and supporting quality healthcare outcomes. I would like to thank you all for participating in this microlearning presentation on safe patient identification and EHR documentation practices. Your commitment to using all three patient identifiers is going to support our safety, improve our accuracy, and help create a safer healthcare environment for the mothers, the newborns, the NICU patients, and all of us. Please continue to apply these practices during every patient interaction and documentation activity. Thank you again. God bless. Have a great day.